everyone. Today I thought I would talk about histamine intolerance symptoms. In last week's video we talked about diagnosis and how histamine intolerance is diagnosed and what tests are involved. And I thought today I'd talk about the symptom pattern. So as I discussed last time, a lot of the diagnosis is based on symptoms. Because testing is not necessarily reliable and there's not a lot of testing available. So the core kinds of symptoms are things that are also found sometimes in other conditions. So it's often a process of exclusion or looking for patterns within the symptoms. So a very common symptom is migraine headache or regular headaches. So if you're the kind of person who always has a headache. And as we know, some of these symptoms can come from other issues like structural issues in the spine, the neck, injury, things like that. But in the case of histamine intolerance, we see them when we've been eating either a high histamine meal, or for people who are sensitive, it may be that they're eating histamine related foods every day, and that's why they have these constant daily headaches and migraines. We also have things like skin rash, eczema, itchy skin and hives. So these are often seen with histamine intolerance as well. And also, you can sometimes have symptoms which are not related to histamine intolerance. So things like eczema and etc. can be related to other things as well, but they are often related to some form of food intolerance. And if not a food intolerance, then some other form of exposure to some form of toxin that the body is reacting to and showing in the form of a rash. Then the other ones are hay fever. So hay fever, sinus issues. Often you see a year-round seasonal allergy where it just seems like you've got hay fever all the time. Asthma, difficulty breathing, lots of mucus, excess mucus through the sinuses, the throat, and runny nose. So this sort of symptom, it could come from IgE allergy, like it could just come straight from an allergy to pollen, and there's pollen all year round. It can also come from histamine intolerance because there's too much histamine in the body, and all of these symptoms are a standard immune system reaction. Of course, you can get some of these symptoms from the common cold. So looking at the pattern though, if we see that these are all year round and someone has, say, a dust mite allergy, but they're doing the best they can to control that, it may well be that that allergy plus food is increasing their histamine bucket. Other ones are excess heat, flushing, and redness. Now this is very much a histamine picture of allergy, where you get redness through the throat, the neck, the head, and the ears. Sometimes people even find that this is starting to move towards anaphylaxis. That's usually more in mast cell activation syndrome, which I'll talk about in the next video. So a lot of times you get really red hot ears. That seems to be something that we see quite often, and it's a bit of an odd feeling symptom like hot ears, but yeah, that's where the histamine sort of shows up in inflammation, heat, and redness and swelling. You also see swelling and inflammation in other areas of the body. Sometimes you'll see behavioural issues as well in kids, and mood is quite related to histamine. You can get a lot of anxiety, PMS, things like that. So you can, because histamine is a neurotransmitter, and histamine is essential in our body and it's used in a lot of functions that are required, but when we get an excess of histamine in the body, this can also affect the function of the brain. It can also increase inflammation in the brain as well as in other areas of the body. Then we've got GI issues. So heartburn and reflux are really, really common, as well as nausea and bloating. And then in the lower part of the gut, diarrhea, constipation, bloating, abdominal pain, and irritable bowel syndrome. Now, you can get these symptoms from other things as well. You can have small bacterial overgrowth, intestinal overgrowth, which is SIBO. So that can be in the upper GI, and that can cause symptoms of nausea and heartburn and reflux and bloating and abdominal pain and diarrhea and constipation. So it's important to see a practitioner who understands whether you have SIBO alone or whether you have SIBO and histamine intolerance, because SIBO can be an underlying driver of histamine intolerance and increasing that level of histamine in the body. Then there's the gut dysbiosis, which is often in the lower bowel, and that is another part of the picture. And diarrhea, constipation, IBS are all kind of related in there. And that can also be linked to other diseases as well as histamine intolerance. So it's important to have someone who's checking that out and understanding what's going on. You know, is there celiac disease present, or lactose intolerance, or fructose malabsorption, or are they present as well as histamine intolerance? Then you've got other symptoms like fatigue, brain fog, and you can even have fibromyalgia. And these can actually be a result of the inflammation in the body from the histamine intolerance. So aches and pains, joint aches, things like that. That can be from histamine intolerance. Can also come from other types of food intolerances as well. It's very much linked to leaky gut and inflamed gut. And I'll do another video on that in some more details so you can understand the mechanisms of how that all works. Then we have other unexplained symptoms, and there are a lot of people who have palpitations and heart issues as well. Dr. Afrin is a doctor in hematology, and he specializes in mast cell activation syndrome. And a lot of heart-related and blood-related things he thinks are related to mast cell. And you do find a lot of people with histamine intolerance do get a lot of palpitations and heart skipping a beat and little things like that. And they'll get them checked out, and there's nothing specifically wrong there. It's just happening. So this can be linked as well to the anxiety, but also linked to those high levels of histamine in the blood. So it's really important with all of these symptoms to actually get them checked out. And although doctors, as a general rule, they don't recognize histamine intolerance because it's not an official disease, you can use that as a process of exclusion to make sure you don't have anything else more serious going on. If there's nothing else going on and you've got a pattern of these symptoms, then histamine intolerance is really likely. And the easiest way to test it is just to eat a low histamine diet for a couple of weeks and see if it helps your symptoms. That is the easiest way. And it feels difficult because you've got to change your diet, but it's actually the cheapest, simplest way to see if it helps. So I hope that's been helpful. You can check out my video from last week on diagnosing histamine intolerance. And I will also do some future videos on mast cell activation syndrome and diagnosing mast cell activation and how that's a little bit different. And you know, you can have mast cell and histamine at the same time. So just keep that in mind. Thanks everyone. If you've got a comment, please leave it below. If you've got any questions, please leave them below, and let me know of any other topics you'd like me to talk about. Bye.